Hi everyone, Lisha here. So we have been starting the topic of pediatric endodontics. First of all, many questions have been arises that how how I am teaching, what is the timetable of my teaching. See, I have been taking all the important topics of every subject in dentistry. Okay, so I have been started with the pedo series. In pedo, I have cleared many topics. Many topics have been left like endodontics, traumatic endodontics, child behavior, and one thing more, I think the child abuse. This all the topics we have been left with. Other topic like traumatology and all I have been covered. Please check that videos, and in between I have been given the three videos. First two is your question answer videos, and one is the pharma 7 more topics. See, I have been putting between different topics just to change, just for a change, because question answering is that much important as learning as the theory. And as we know, every question is a case based question, a practical question. So the theory part is covered in my theory lectures only, and the question answer part will be covered in the question answers round. Okay, so today my topic is pediatric endodontics. What is pediatric endodontics? See, there is a tooth morphology difference between the permanent teeth and primary teeth, right? So in primary teeth, they are having the diverge root, they are having the pulp horn, they are having more bulk pulp, they are having the thickness of enamel and dentin very less, and many more. The cusp size, and many more. The number. So there is a difference in the endodontics of an adult and a child. I will cover you the topics which is extremely important. My first topic is the difference between indirect pulp capping and direct pulp capping. Okay. So the difference between indirect pulp capping and direct pulp capping. What is indirect pulp capping? First difference, if you can understand, you will make through all the differences. Indirect pulp capping which takes place when the pulp is exposed in a big manner, like in traumatic, like when it broke down, or in many cases like during any surgery and all, or due to some exposure that causes a bulk pulp to be exposed. There we have done with indirect pulp capping. And what is direct pulp capping? Where a pinpoint exposure is seen, there we have done the direct pulp capping. Okay. So indirect pulp capping is where we have a pulpal inflammation. First. Second, when has been, we also can judge when it has been minimal and complete removal of caries would cause a pulp exposure. Due to caries we are having a pulp exposure. I have told you, जहाँ पे भी pulp exposure ज़्यादा है वहाँ पे हम लोग indirect pulp capping करेंगे. जहाँ पे pinpoint है वहाँ पे हम लोग direct करेंगे. For example, during the dental treatment we are having a pinpoint. We generally, or we as a fault in our treatment, we have done a pinpoint exposure. So that is in your direct pulp capping. Clear? Now the second difference, the material. The material used in this and this is same, but in direct there is a little more components we can use. In materials which we have been using, here is calcium hydroxide. Here also we can use the same. Okay, but here one thing more we can use is ZOE. But here we can use the four things we can use that we have to remember. First one is your isobutyl cyanoacrylate. Isobutyl cyanoacrylate. Remember it as a ICA. Second is your resin bonding agent. Resin bonding agent. RBA. Then is your antibiotics A and C. By this you can remember. Okay. ICA, RBA, A and C. ICA, isocyanoacrylate. RBA, that is your resin bonding agent, antibiotic and corticosteroid. Okay. Now come to your contraindication. See, if we are doing the direct pulp capping, it is for sure that we have to remove a good portion of the teeth. So it is non-restorable. Second things, there is a sign or the periapical pathology. There may be a pathology. It may be sensitive with the hot, cold. But in direct pulp capping, the contraindication is something different. That is pain at night. Pain at night might be felt. Then there might be, I have told you during the dental treatment, there might be, means it's an accident condition. So the pain will be spontaneous. Okay. And then the excess bleeding at the pulp exposure. Exposure. So we use a cotton pallet. In direct pulp capping. I think I am clear to you that in direct pulp capping, and in indirect pulp capping, it's a bulk of pulp exposure due to caries or trauma. This is due to your incident or a pinpoint exposure. Here we are using calcium hydroxide ZOE. Here we are using ICA, RBA, antibiotic, corticosteroid. Okay. And other than that, the contraindication over here, non-restorable, but here there is a night pain and a spontaneous pinpoint exposure or spontaneous pain. Okay. This is our first topic. Now, the second topic, conditions. Your conditions. In what condition I can divide it as primary and permanent. Okay. It's primary teeth, the condition will be the permanent teeth, the condition will be. These two conditions I have been divided with. So I will explain you one by one that what is the condition and what will be the treatment. Okay. Okay. For this I need the whole board. First of all, I am starting with your permanent teeth. First of all, I am starting with permanent teeth. The problem is vital tooth with small pulp exposure. The teeth which are having life, which are having pulp, which is living, is vital. Okay. So ऐसा एक दांत जिसमें कि हम लोगों का पल्प एक्सपोजर हो चुका है. एक दांत है where we are having a pulp exposure. What we will do? Obviously, it might be a small exposure. So, direct pulp capping. Okay. In small exposure of pulp. First. Second. Vital immature tooth with the large pulp exposure. Okay. For example, it's a vital tooth but immature. What do you mean by vital? Means living. Immature means during your eruption tooth. As a dentist, what should be your funda? To save the teeth, right? तो vital है, it is living, but immature है. That ये अभी erupt हो रहा है. उस पर्सन को इस टीथ के साथ पूरा लाइफ रहना है, मीन्स तो हम लोगों को इस टीथ को बचाना है, वी कैन नॉट डिस्ट्रॉय इट, राइट। सो हम लोग को रीजनरेशन प्रोसेस करना है। इसमें और इसमें हम लोग का सोच में यही डिफरेंस है कि ये अभी इरप्ट नहीं हो रहा है, ये इरप्ट हो चुका है, पर ये इरप्ट अभी हो रहा है, ये अभी इमैच्योर है, अभी द चाइल्ड इज स्मॉल, ओके। तो हम लोग को क्या करना है, रीजनरेशन करना है। इसलिए हम लोग इसमें क्या डालेंगे, कैल्शियम हाइड्रोक्साइड। दिस इज द सेकेंड कंडीशन। Now come to your third condition, non-vital immature tooth. Okay, here is your teeth. It is non-mature. It is a non-mature, non-vital. ना तो ये जिंदा है और ना ही ये मैच्योर है, तो हम लोग क्या कर सकते हैं, तो इसमें हम लोग का रीजनरेशन वाला फंडा, तो इफ वी कैन सेव, अगर नहीं लगता है तो वी हैव टू स्टैंड आउट, मीन्स हम लोग को स्ट्रेंथ देना है टीथ को। तो हम लोग टीथ को स्ट्रेंथ डायरेक्ट पल्प कैपिंग से तो नहीं दे सकते, क्योंकि एक कॉटन पैलेट लेके यू कैन नॉट गिव अ स्ट्रेंथ। हम लोग कैल्शियम हाइड्रोक्साइड से नहीं दे सकते, क्योंकि रीजनरेट कैसे करेगा, ये तो ऑलरेडी नॉन वाइटल है। तो हम लोग उस टाइम पे क्या करेंगे, वी हैव टू डू एपेक्सिफिकेशन। I will explain you what is apexification. Okay, apexification. By the root wise we have to do it. Excuse me. Now your third topic. Okay, third is your non-vital mature tooth. Now the teeth is your non-vital but mature tooth. ये it is not living, it is dead, but it is mature, ये mature है। At that time what we can do, it is a normal thing. See, when a patient come to you, ये तो permanent teeth है, obviously हम लोगों को मतलब elder patient या adult ही आएगा। तो adults अगर आएंगे और ऐसा वाला condition है, और generally हम लोग यही condition हम लोग देखते हैं, तो उस टाइम पे हम लोग क्या करेंगे, उस टाइम पे हम लोग करेंगे रूट कैनाल ट्रीटमेंट। रूट कैनाल ट्रीटमेंट, is that clear to you? 4 conditions in permanent teeth: small exposure of pulp, direct pulp capping; when there is an immature tooth, calcium hydroxide; when there is a non-mature, non-vital, apexification; when there is a vital immature tooth, when there is a non-vital mature tooth, then we can do your root canal treatment. Okay, now I will explain you about the primary teeth. I am going it slow just because to make you remember the things one by one, because this is very important, and as the questions are coming in a practical way, so this is very important to know. Okay, now come to your primary teeth. What is the primary teeth is all about? Okay, vital tooth with deep caries. You have a vital tooth but have a deep caries. Okay, so the pulp is exposed more. क्यों मैंने ऐसा बोला, क्योंकि इसमें डीप केरीज है। और मेरा लेक्चर शुरू होने से पहला पॉइंट क्या था कि अगर पिन पॉइंट होगा तो हम लोग डायरेक्ट पल्प कैपिंग करेंगे, पर अगर पल्प एक्सपोज हो गया एंड इट इज वाइटल, अभी भी जिंदा है, इट इज नॉट डेड, ओके, तो हम लोग इसको बचाने की कोशिश करेंगे। कैल्शियम हाइड्रोक्साइड तो दे नहीं सकते बिकॉज इट कैन नॉट रीजनरेट, सो वी विल डू indirect pulp capping. So we will do indirect pulp capping. First condition. Second condition. For example, a vital tooth with a large pulp exposure. A vital tooth with a large pulp exposure. Vital and large pulp exposure. C. Indirect pulp capping अब से भी ज्यादा अगर पल्प एक्सपोजर होता है और ये क्या है, ये प्राइमरी टीथ है, तो हियर वी कैन डू इफ दिस थिंग, सी इट्स अ वाइटल टूथ, अगर यहाँ पे अगर हम लोग का नॉन वाइटल हो जाता देन वी कैन डू हियर द रूट कैनाल ट्रीटमेंट, बट इट इज अ प्राइमरी टूथ, इट्स अ वाइटल टूथ, इट्स अ पल्प एक्सपोजर, सो वी कैन हियर डू द formocresol pulpotomy. Okay, so we can do the formocresol pulpotomy. Now come to your third condition. What is the third condition? Is pulpless tooth with 2/3 root strength available. किसी ट्रॉमा या केरीज के कारण अभी सिर्फ 2/3 टूथ ही बचे हुए हैं, स्ट्रेंथ अवेलेबल, मतलब दिस इज समथिंग बेटर, दिस इज मोर वर्स देन दिस एंड दिस इज मोर वर्स देन दिस. ओके, तब हम लोग क्या करेंगे, बट वी आर बाउंड विद द कंडीशन that it's a primary teeth. We are again bound with the condition that it's also a vital teeth क्योंकि अभी तक 2/3 root जिंदा है. And our point is to save the tooth at any cost. So we will do pulpectomy. Now condition number 4. Tooth with poor prognosis. The tooth has gone. Tooth with poor prognosis. Poor prognosis can be in the permanent tooth, can be in the primary tooth, but it's a primary tooth, तो permanent tooth आ जाएगा. So अगर हम इसको जॉ में ज्यादा देर रखेंगे, it might cause infection. So we do extraction in this case. So I am clear with this. I have 4 things. Indirect pulp cap, your first thing is a little pulp exposure, but not little, it's just a deep caries, so indirect pulp capping. इससे ज्यादा पल्प एक्सपोज हो गया तो फॉर्मोक्रिसोल पल्पोटॉमी, इससे ज्यादा पल्प एक्सपोज हो गया तो पल्पोटॉमी, ओनली 2/3 बचा हुआ है देन पल्पोटॉमी. एकदम ही वी आर having a gone case कि teeth अगर रहेगा तो it may cause infection, with a poor prognosis we will do extraction. So here I end my first lecture. In the second lecture I will continue from here on. Thank you so much and have a nice day.